So firstly, welcome everybody to the workshop, Remapping the Functional Organic Distinction in Psychiatry and Neurology. My name is Vaughan. I'm an academic at University College London, and I'm also a consultant clinical psychologist working between psychosis and neuropsychiatry services. Before we start, I'd just like to mention a few words about the focus of today's workshop. So, the functional organic distinction attempts to differentiate symptoms, signs and syndromes that can be explained by diagnosable biological changes from those that cannot. It is absolutely central distinction in clinical practice and forms the basis of lots of our diagnostic systems. Beyond this, it has an impact on the people with difficulties, challenges and disabilities who seek help for the challenges they face, and also has a huge impact on how us as individuals and how society interprets some of the challenges and disabilities that people live with throughout their lives. One of the fascinating things about the functional organic distinction is it has been deeply controversial. This is a quote from the neurologist Wilkinson in his landmark textbook of neurology. This was in 1940. He says, "It lingers at the bedside and in medical literature, though it is transparently false and has been abandoned long since by all contemplative minds. It has been criticised for maintaining the stigma associated with mental health problems. It has been criticised for promoting naive dualism, and it has been criticised for causing diagnostic chaos. And yet, it remains. And indeed, it remains in the clinic, and it remains in terms of how we understand medical difficulties, and it remains in terms of society's understanding of different problems that people face. So, one of the things that I'm keen for us to do today is think about some of the problems that arise from exactly this tension. Perhaps today we'll think about some questions such as, if the distinction is clinically useful but scientifically vague, what does it reveal about the medical understanding of human experience? What's the social role of distinguishing functional organic, and who does it affect? And are there realistic alternatives? We've got a list of fantastic speakers today who will be thinking about some of these issues, but also many issues beyond. We're very lucky today to have Gareth Owen, a psychiatrist and reader in mental health, ethics and law from King's College in London. Peter Gilli, a person with functional neurological disorder and an advocate for disabled people. Torie Robinson, an advocate and campaigner for mental health, people with epilepsy and brain surgery patients. And Tehseen Noorani, a senior lecturer in clinical and community psychology from the University of East London. Anne-Lee Jeffson, a philosopher of psychiatry from Cardiff University. And John Stone, a professor of neurology from Edinburgh, who, no thanks to COVID, will be joining us virtually for the final talk. So, before we start thinking about some of these issues, I just want to thank a few people. Firstly, thank you to the Fellowship of Postgraduate Medicine, who have funded today's workshop, and thank you to the Medical Society London, who are hosting us today. Thank you also, a huge vote of thanks to the organising committee for today's workshop. Sam Wilkinson, philosopher of psychiatry. I think we first talked about this about 6 years ago, Sam. It's been hugely helpful in both some of the conceptual issues and the practical organisation of today's workshop. Tim Nicholson, one of my colleagues from psychiatry, first noticed the funding opportunity, has been absolutely huge in helping to organise and run today's workshop. Peter Gilli brings his own experience of FND, but also is hugely knowledgeable about all of the research and science behind the condition. Monica Greco, no thanks to COVID again, sadly can't be with us today, sociologist of medicine, really influential in shaping some of these ideas. Headway East London, that's a title that actually hides a whole range of people. I've been working with Headway for some years now, really fantastic brain injury support organisation. Spent some years talking to them about lots of these issues. Callum Hendry, fantastic to have you here. Helped shape some of the original ideas in our publication. Laura Owens, one of the directors, been hugely important in this, and I see a few more Headway faces around as well. Quinton Deeley, broad-thinking psychiatrist who I've worked with for many years, so thank you for supporting this. Tehseen Noorani, who I think has changed my mind on many things back and forth more times than I can imagine, so brings a huge wealth of experience and scholarship. Good to have you here, Tehseen. And Torie Robinson, absolute force of nature, a campaigner and advocate for people with epilepsy, and also a campaigner and advocate for engaging with the science and clinical practice of neurology. And finally, thanks to you. Thank you very much for coming along. This is called a workshop for a reason. We're really keen to workshop some ideas, so feel free to think aloud, feel free to engage with some of the ideas. It'll be really interesting just to hear some of your questions, some of your ideas, however well formed they are. If you don't feel lost at some stage, you're probably not a member of the audience today, because we're going to be covering everything from philosophy of mind to neurology to people's lived experience to sociology. So, we're deliberately covering a huge range of ground. If you're feeling a bit lost at some stage, I'll probably be right behind you. And I'm just aware that we're going to be touching on some controversial things today. We're going to be touching on some things that are deeply important to people on a personal level. So please assume that questions, thoughts and opinions are constructive and meant in a constructive way. And hopefully, through all of the shared experience in the room, we can forge some new ideas and some new perspectives. So without further ado, I'm going to hand on to our first speaker, Gareth Owen.